we're going to now go through this video and look at it from the facilitator's perspective about what sort of areas we would want to comment on and explore in terms of what went well and what things could be changed, with the goals in mind about interprofessional education. So here we are with people coming in. Let's see the transfer here. Is this something any of you would use as part of the interprofessional goals currently?
I'm just wondering about Alicia in terms of the transferring and helping that patient get in onto
the dental chair.
The dental
chair.
Yeah. And see, so my perspective too, and we can all talk about this, is just like that would be something you could bring in, but if you don't have time because your goals are to hit the interprofessional education, you would make a note about it. And if you have time to get to it, you would. Now I notice here's where the student is talking with the PSW student. As some of you have commented on and you have noted that the communication between the three of them seems a bit interesting in the sense, I guess, just the healthcare professionals seem to be talking more and the patient is sitting there in the chair. So this is happening throughout. The question would be, what is the best part and what part of this video would you actually use to demonstrate that?
So I would probably just show this exact introduction that when they came in at this particular point. I would show about 30 seconds of this film here, and I would ask them what they observe in relation to all of the information that they've learned in class around interprofessional collaboration and interprofessional care.
Mm-hmm. Yeah, because I think part of the interprofessional care is that the person that's being treated is also part of the circle as well.
Well, from a patient's perspective, from the moment the patient enters the clinic, he's trying to understand what's happening between the two professionals, but like it was mentioned, the communication is interesting. They seem to have ignored him completely, and I think reason for that would be the amount of time that this visit has, because it's very short, so they're concentrating more on the knowledge transfer. Mm-hmm. And I guess later on the PSW would go through with the patient about what happened, and if there are any doubts, maybe should clear them up. But that's not quite obvious when we watch this one.
So if you notice, the dental hygienist in this role is not really acknowledging the client for whatever reason, maybe because all of the items are set up on the back counter, and a dental hygienist is usually accustomed to having most of her equipment either on the front tray or just a small amount of equipment held in her hands.
And from my perspective of the personal support worker student there, I would ask her about the inclusion of all of the interprofessional collaboration, interprofessional care that she had learned in class regarding her patient. And how, when she goes into this clinic, what was going on when she was in that room, that she seemed to have not paid as much attention to the patient as maybe she would have.
Yeah, because I've also noticed that, and I don't know what you would do here, the PSW student keeps nodding her head. Is that something you as facilitators would want to touch base on about?
Yeah,
I don't know
where
she was.
I'm just not sure if the nodding is related. I'm curious about what the nodding is related to. It can be a couple of things, but it'd be really nice to get her frame of mind, and that way I'd be able to really kind of understand where she's coming from and help guide her in things. Maybe she just doesn't even really know that she's nodding her head. Maybe she's nodding her head because she has done this several times before, and this is not new material for her, so she's not nodding her head in agreement. Or maybe she's just really quite nervous and wants to be very attentive to what's going on and be sure that she's capturing everything that dental hygienist has seen for her. And this is just her way of showing that she's listening attentively.
Well, I think that the dental hygienist has a lot of information to give all in one session, and it's probably overwhelming her.
So one way that I'm thinking of when you're talking about, being that student in that particular simulation is using a debriefing format called GAS. Okay. Which gathering the emotions, the feelings, how things went for them initially, and then analyzing all those things that you've done, and then making a summary of what you could do differently next time. So it's sort of getting at that emotion so that people can get rid of, oh my God, I can't believe I actually did that. I would never do that, to this is the way I would have done it. This links back to here. Here's how it didn't work for me because of the environment not set up right, or I felt this pressure because the camera was on me, or those kinds of things. And then you can get back to, okay, so let's talk about how you're going to do those things differently next time. What is it that you can change, that you can take forward in your care?
So again, going back to the whole briefing is so important for doing a good debriefing is, as you said, like getting the learners prepared, but also even telling them they can take a break if they're feeling overwhelmed or not sure what's going on. They can say time out, for example, if that's allowed. And that gives, then they usually don't because they know they could, versus going on autopilot for a while. Because again, we know from the literature that, you know, if someone's hearing tons and tons of information, like the PSW nodding your head up and down, we don't know how much is being absorbed.
I think one of the things that comes out from the debriefing point of view, the patient must be thinking that how come the PSW is not taking any notes, you know? So, so maybe that's one of the things that the PSW needs to understand, that next time they go, maybe they need to jot down, because it's a new field of knowledge for the PSW. You know, she doesn't have the dental skills that the dental hygienist has. So
even though you can't speak, your role is still getting a bit nervous, like, why don't you just nod your head up and
that's
down?
right. And not writing anything down. Or recording something, so that if I have a doubt, I can ask her later.
So I would then, as a facilitator for a debriefing, I would then go to the patient and say, Mr. Sharma, I noticed that you didn't say very much in the scenario, in the simulation. Can you help me understand what was going on at that time?
And then Mr. Sharma would probably bring out his thoughts as to what went right and what went wrong.
And the pain.
And the pain.
And then I would then go back and open this up to the other people, participants, the observers that are involved in that particular simulation, and ask them what do they think about that? What would be ways to handle this particular scenario, knowing that maybe your patient may be in pain. So is there something you would do differently?
This is why it's so important, if you have the time, to run it again, to let them kind of say, oh. And again, even then they might not do it perfectly, because although I remember the student role that describes practice makes perfect, well, practice moves one towards perfection, but there is no perfection,
that's
right?
true,
Because you never get there, but you can get better and better. And that's an interesting thing, if the student actually tells you that as a debriefer, going, if I keep doing it, I'll get perfect at it, you can start talking about what does that actually mean.